My first admission was one of many. I continued to get kidney stones on a regular basis. I had to have a number of surgeries. I had to continue seeing my specialists on a regular basis, and unfortunately, I was at the hospital a lot, so I really got to know it. When the doctors and everyone came in the morning for rounds, I was really overwhelmed because there's like 8 or 10 people that come in, and they're all supposed to be taking care of you. Again, I was nervous, but my mom was helping me along. My nurse was in the room as well for when they were doing rounds, so she was kind of reassuring and telling me, okay, everybody's gonna come in now. The doctor made me feel very comfortable. He treated me really well, and he explained, what was going on to me, which I really appreciated, versus explaining it to my mom and then telling me. He involved me in my care. He asked me what would help, what I think would make it worse. I think especially in the younger teens, it's crucial to involve the patient in their care, because in a few years they're going to be put into adult care and they're going to be responsible for their health. They're going to be responsible for, doing tasks to help themselves, and they're going to have to learn to explain their diagnosis and their problem in the future. And so I really appreciated when the doctors would speak to me. And I think each time that they asked me questions built up my ability to advocate for myself, because I was in a comfortable setting where the questions weren't too overwhelming. And it brought me to a point where I feel perfectly comfortable advocating for myself, whereas a lot of youth I find don't. Their parents do most of the speaking, and of course parents with sick kids are a lot more overprotective and careful, so I don't think that the children get a chance to really speak up. So when they can, even in small increments, it all adds up. It teaches them from a young age and at a slow pace. They're not just thrown into the adult world expecting to know everything when they haven't been taught everything. So I think especially starting young, you want to slowly, not all at once, but slowly involve them in their care, give them a better understanding of what's going on with you, because it's happening to you. You should know what's happening. I kind of think that transitioning from peds to adults is like going from elementary school to grade 12. You're in a new environment, you don't know who people are, you don't know where you're going, you don't know what you're going to learn or encounter, and it can be a bit intimidating. It was really difficult for me going from pediatric to adult care, because at the time there were virtually nothing set up to support youth transitioning. My clinic nurse practitioner, she kind of helped me along and told me, okay, you're gonna have to get a new urologist, you're gonna have to get a new family doctor. You've gone from having a relationship with these physicians, having that trust that takes time to build, to going into someone that you have no idea who they are, you have no idea how they're going to treat you, and it can be a bit intimidating. You're leaving your comfort. What I would like caregivers to know about youth transitioning to adult care is that it's a scary time, and they're going from being in a place where they know and they're comfortable to a place where they've never been. They're going to have to do new tasks that they've never had to do for themselves. Even simple things like filling a prescription or booking a doctor's appointment. Surprisingly, a lot of youth don't know how to do that. I find in adults versus pediatrics, they kind of expect you to be a 35-year-old independent woman when in reality you're only 17. And just because you're no longer in pediatrics doesn't mean that you're an adult. In a way, I'm kind of glad the things that I've been through, because it's made me who I am, and it's made me very capable of advocating for myself. And not only for myself, but I feel like I'm able to advocate for others through the Youth Advisory Council and various different things.